taking care of individuals with bipolar disorder, it's really important that we remember that this is a multi-system disorder. So, although it sort of falls under the, under the domain of psychiatric disorders, it's of course not limited to the brain. We know that it has a huge impact on it's a pro-inflammatory condition. It affects it has metabolic effects. It has endocrine effects, and so it's really impossible to think about somebody with bipolar disorder as simply having sort of psychiatric manifestations of the disorder. So this really has to be an integrated approach to care, and so it's essential that we think about this is a systemic illness that we address in an integrated fashion. And so again, depending on your healthcare setting, it may be that you are the one who's managing multiple systemic aspects of the disorder, that you're the one who's following up on endocrine function, on the metabolic consequences, cardiovascular consequences of bipolar disorder, or it may be that you refer them to specialist care. But in any event, it's really important that there be crosstalk among members of the medical team in order to provide integrated care, because otherwise we're really doing a disservice to our patient, because it's not addressing all the treatment needs of the person who has bipolar disorder, and ultimately we aren't able to address their needs by delivering siloed care. There has to be communication across providers, and of course it's very difficult to do that given all the constraints that we're facing in terms of time. But this really is what we need to do in order to deliver appropriate care. I would challenge us as psychiatrists to be more engaged in thinking about our patients holistically. I think traditionally we have been somewhat reluctant to take responsibility for the cardiovascular health of our patients in particular, it's increasingly apparent that cardiovascular disease is a part of bipolar disorder. We know that the individuals with bipolar disorder are probably twice as likely as individuals without bipolar disorder to have a host of cardiovascular diseases, and of course many of the medications that we prescribe exacerbate this risk, and so it's really impossible for us to disentangle what we're doing to manage bipolar disorder without thinking about this. And so I think that it's part of our responsibility to think about to be tracking cardiovascular parameters, and to be turning to our colleagues in internal medicine with additional expertise in order to address, to think about ways to mitigate cardiovascular risk factors in order to promote health and well-being. I think that we can take a leadership role in forming these integrated health care teams in order to provide optimal care to individuals with bipolar disorder. And I really think that we should be thinking about this as our mission. We're the providers who are likely to have the most contact with people with bipolar disorder. We're likely to see these individuals more frequently, and so I think we're probably in a better position to advocate for their health in a variety of domains. So whether that would be actually contacting our colleagues in internal medicine, or really encouraging our patients to seek consultation with another provider, to really keep that at the forefront of our treatment planning, is something that is essential that we do as we manage our patients with bipolar disorder, and use medications that can be very helpful, but also can increase a variety of risk factors. I think it begins by listening to people, finding out what they want to do, and helping to find ways to support their choices, in making sure that bipolar disorder doesn't get in the way. And I think there's some concrete things that we can do, information that we can provide to help people reach their goals. One of the things that I think about often is the impact that schedules, routines, and sleep have on bipolar disorder. And so I often find myself talking to people about how they can modify their schedules and routines to support their health with bipolar disorder and also achieve their goals.